Hi, my name is Andrew Carr from the Massachusetts Department of Children and Families. I'm here with my coworkers and colleagues, Christine Bailey and Tim O'Brien, to talk to you today about a challenging training endeavor that we successfully met and some of the challenges involved in that and how we got to a successful end. Let's first talk a little bit about what the Massachusetts Department of Children and Families is, what we do. We are the state agency in Massachusetts charged with protecting children and keeping families together as much as possible, responding to reports of abuse and neglect to the tune of in excess of 100,000 of those per year, servicing up 40 to 50,000 children at any given time, providing foster care for those children. Children who aren't able to return home to their families may end up on an adoption track, and of course, addressing the ongoing needs of all those children while they're in our care. Our project involved 4 primary objectives we were really trying to meet. They involved the develop of a blended training plan, one as we had never done before to this extent, around classroom training, distance learning, and e-learning available to our staff as training options. We had a number of trainers to train, 7 to 8 trainers who knew nothing about our agency that needed to be trained on both our culture, our staff, and of course our IT policy and practice changes that were part of this rollout that we were doing. We needed to deliver this to a large group, upwards of 3,500 people across the state of Massachusetts, which posed another challenge, and we had to do that in a timely manner. It was a project that was being very closely watched by both our staff, our administration, and the governor of Massachusetts, who had actually talked about this project in DCF reform in his address to the state after he was elected in 2015. A little background for us as far as the state and the structure of the department that we work for. The red pin there on the map, as you can see, is our office in downtown Boston. We're structured with 5 regional offices around the state of Massachusetts and 29 area offices. Those offices containing 3,500 or so staff, the staff that we need to support through our IT policy and practice changes. In 1998, we rolled out our first enterprise case management system. It was a client-based system, of course, in 1998, so staff really had to be at their desk to be able to enter information, and they're entering lots of information. So they're a very mobile workforce. They're out doing visits with staff, visits with providers, going to court, etc. And this meant that they needed to come to the office to enter any information into the case management system. Over time, we slowly transitioned and are still transitioning to a web-based system, which of course allowed for more mobility. Along with that, actually along this transition, which is still in play today, back in 2014, to really reinforce the idea of a mobile workforce, we deployed iPads to all of our staff, and we continue to deploy iPads and provide iPads for our new hires to the tune of about 3,700 or so across the state at this point. As I said prior, the client-based system, which staff had to be at their desk, this opened up the door for staff to both have a web-based system and be able to access it from a device mobily, so they're able to do their work without coming back to the office. This also helped us, as you'll see later, with our training approach, because we didn't need to provide hardware. That was one obstacle we had an immediate answer for, was staff could bring their own iPads to the trainings for the hands-on portion of the course. We did have many needs and challenges, as we said, to get into a little bit more of the real content here. Is the thing that was rolling out was a combination of policy and practice and IT changes. It was big and it needed to work immediately. It was surrounding a fundamental tool that we used to provide for the children and the families of Massachusetts. It had to work. And we already talked a little bit about all those eyes on us watching to make sure that it would. Our commissioner, Linda Spears, had this quote: "The Family Assessment and Action Planning Policy," which is what we were working on here, "profoundly changed the way we do our work and, most importantly, enhanced our service delivery to the children and families of the Commonwealth." So what did we need to do? We needed to find a way to train 3,500 staff spread across Massachusetts, Cape Cod to Western Massachusetts. We had to complete that within roughly a 1-month time frame. So we had to get 3,500 people trained in about 4 to 5 weeks, all while under that watchful eye of the Massachusetts government. DCF, we had limited resources. So when we talk about resources we need, and many of you would know what some of those resources are, logistically, we need locations, and we need training environments, we need hardware, we need a learning management system, we need coordination of all these different events. We're a small operation, and we really did not have all those at our fingertips. Back to the map that we talked about a little before, how could we cover this entire space and get this done in the time frame we had? Well, one of our primary challenges, some I just mentioned, another one, how would we do this? Well, the training unit that we have in the department is a training unit of 1, that is me. I obviously could not cover that entire map by myself in 1 month and train 3,500+ people in that time. Obviously not going to happen. So what would we do? I'm going to hand off to my colleague Tim.
All right, so at this point in the project, we knew the product we needed to deliver, and we knew the timeframes and the mandates we were under by state government in order to get this done. And that started at us asking the questions: who's going to deliver the training, reassessing who our learners are to make sure we knew how we were going to get this information out to the field. And we came up with some ideas initially in our meetings of who could we use to train? Could we borrow staff from the field? Could we consolidate our own IT staff? Think of this as you're sitting at your desk maybe in your own companies or agencies right now, what that would mean to take people out of their current positions and move them into another field that maybe they're not familiar with or have that much experience with. And we knew we couldn't take social workers out of their daily jobs, supervisors from the field out of their daily jobs, and move them into training positions. That just wasn't feasible for our agency at the time. We talked about making policy experts into IT experts and vice versa, making IT experts into policy experts, and we knew that comes with some downside as well. It costs to create the capacity of the knowledge that can be transferred to the learner, having people delve outside of their specific fields, and that our learners would pick up on that in the agency. The next thing we talked about was leveraging our Child Welfare Institute. And the Child Welfare Institute at DCF is the clinical training arm of our agency. They're tasked with delivering the knowledge, skills, and abilities to social workers for evidence and skills-based practice. And they're the ones on the ground with our social workers the entire time they're training within the agency. This came with some challenges too. We knew our social workers were going through their other professional development requirements at the same time, and we weren't going to stop any of the other programs that we were going to be doing at that point in time. We had our new social worker professional training program happening. We had our new supervisor training series happening, new manager training series, in-service trainings. Just through our new worker training, we had over 600 individuals at this point in time during this fiscal year coming through our new worker training. So that talks to the amount of turnover our agency has to be bringing in 600 new staff during this time of this new policy and IT rollout. The next thing we thought about was our learner profile. We had to reassess who our learners were. We didn't want to make assumptions based on what we thought we knew about our learners. We had, as Andrew mentioned, about 3,500 social workers in the agency that needed to be trained on this new policy, and we knew that our learner profile encompassed a wide range, and that was educational level, age, agency experience. All those things vary greatly within our agency. We had age ranges of social workers between 22 and 82. We had agency experience from 1 month to 37 years. I think about 47% of our agency social workers were in the agency under 5 years. That's a very wide range of experience that we knew we had to reassess, see how folks wanted to learn, and not make assumptions on that. So what we did next was send out a learner profile survey. We wanted to know how staff felt about learning new policy, how they wanted to learn. Did they want hands-on learning? Did they want classroom-based learning? Did they want small group learning? Did they want e-learning? Same for how do they want to learn about new IT changes? We had to figure all of that information and make sure we had the right blended learning approach to roll out this new project. Some quick results that we found out. Location was very important for our staff. Andrew showed you the map earlier of all our offices spread out. That kind of showed that folks, where they were in the state, and if they were in their offices, they didn't want to be trained in their offices. They have a lot of things going on in their offices, from clients contacting them, their coworkers asking them to cover cases for them, supervisors asking them to do the different things. Learning needed to take place out of the office, so that was a big thing that we found out from that learner profile survey, is that they wanted out of the office to go learn this new material. Classroom was preferred, but they also wanted many other methods, so that's why we started looking at bringing in a good portion of e-learnings to this, and there was a strong need to make sure staff had choices. We needed to give them enough options to make sure their learning fit their needs, to make sure we had that right amount of transfer of knowledge for this project, to make sure this information stuck with them after this rollout. Right, I'm going to hand it off to my colleague Christine now.
So those were some of our challenges and some of the things we thought about, and obviously with the training unit of 1, we needed some help. So being a state government agency, when you need help, you issue a procurement. You need to do a competitive procurement, and we went through that process, and we were looking for a partner to really work with us on a co-training model. So this is a little bit different in that we weren't just hiring someone to train on the IT. They really had to partner with us and learn the business and work with us. So through that process, we ended up hiring a company called Training Associates, and these were some of the things that we had asked them to help with. Taking consideration all of the logistics of scheduling of 3,500 people across the state with snow days, and that was a piece of it. But the core piece was really about hiring trainers to work with us and do the co-training and really learn the agency culture and help. We did ask for a bunch of different kind of differentiated instructor-led trainings, both kind of remote distance web-based trainings as well as in person, and we had 3 or 4 different kinds of classes. And we did ask for not only the trainers themselves, but also kind of some floaters and folks to help with that. One of the really important things we'd learned from previous procurements is that it made sense to have them do what they were good at and keep us with what we were good at. So DCF has all of the knowledge and the content and that piece of it, so we decided to develop the curriculum ourselves. We also developed the e-learnings ourselves, which supported this, and asked for the vendor to help us deliver the in-person trainings. So we really did need a partnership, and you can see here some of the divisions of what the agency kept on and what we asked our vendor partner to help with. But the key piece that I think was so important to this was what we called our train the trainer approach. So Andrew mentioned this was about a 4-week training effort, but when we've had people come in and train in the past who don't understand the agency, who don't know anything about social work, it's very unsuccessful. People are really immediately unhappy with it, and there's a lack of trust, feeling like you don't know what it is we're talking about. So we asked our partner to work with us over an actual 3-week period, so a very, very long train the trainer period, to help really learn the agency's culture, what people's experiences were, how they felt about training, some of the learning profile stuff that Tim had spoke to in the past, and really work with us. And in that, we also had them help us prepare for the training. So they used the system, they helped us put in the data, they looked at our curriculum, we used their expertise and all that they had to go through that. They also, as I mentioned, help with the logistics. So this is just an example of our schedule. So we were running about 8 sessions at once, and in it we had these co-trainers of a DCF policy trainer working closely with an IT trainer. Another big piece of it that we really wanted to do from previous is make sure that the trainers themselves were supported and that people could get answers to questions while they were in the room. From a trust perspective, people have not had the best experiences with DCF in terms of getting follow-up to questions outside of the room. So we had a lot of supports in place for the trainers so that there was a series of people that they could call if they had a question in the room. And we really took advantage of the iPads and the technology options so that while they were in the room, while one trainer was training, another trainer could be on our intranet sending in a question, getting it answered, looking up at the policies, referring to the e-learnings, and so they had a really lot of support around them. So the end result of all of this was actually really, really successful from our perspective. So these are some of the numbers, but overall 94% of our folks said that the training was either excellent or good. From past trainings, we were more in the high 70s, low 80s for percentages, so that was a great result for us. They were very favorable about the instructors, and most importantly, they walked away thinking that they understood the policy changes and they understood the IT changes. So 99% of the people said they knew how to use the IT system to do their job at the end of the day, which we think is a phenomenal result for us. So that's where we were, and that's what we did. In terms of where we are today, we're about 6 months out from this training and this rollout. So since then, we've been doing a lot of follow-up trainings that are really topic specific about the business and the implementation. But we also wanted to see people were very favorable during the trainings, but how do they feel now that they've been using the system? So we're in the process right now of conducting a 6-month implementation assessment. So we have a survey open that's going to close shortly. And what we're finding is that there are definite areas where people have policy questions or IT suggestions, but we aren't getting a lot of feedback about the need for additional training on what's been covered. So we feel really strongly about that and that we had a good program in place. So lessons learned, and I would say these are almost lessons relearned for us. These are all things that we knew, but the biggie for us was that we really needed to trust our learners. About 85% of them said they wanted in-person, but 15% said they wanted e-learning. And our organization kind of had a tendency to say, are we sure? Maybe they don't know. When they really know what this is, maybe they need a classroom. But we think part of why we were so successful and people felt so good is because they chose. They picked the learning style that worked for them and were able to move from there. We also really stressed the need to use our own expertise, but get help where we needed it. Finding the right partner was a big one for us. I would say a key piece for that is just making sure that it's someone who's going to work with you when something goes wrong. We did have a couple of situations that we needed to work through and to help particular people, and we really felt like we were able to put things in place quickly to address anything that came up. The technology piece I just spoke to was really, really key. I think it really helped us to build a lot of trust and get information out of there to help collaborate during the sessions. And then our really big key takeaway is it is worth the time on Train the Trainer and culture. There's a famous saying that culture eats strategy for breakfast or lunch, and I think that's really true in our organization and a lot. So taking the time to really embed our trainers in that was very helpful. Thank you very much.